Wow. Thank you. We can look out over the room and see our community and our state's commitment to this cause. We have been overwhelmed by your reception, by the reception of the community and those who are standing with us and participating in the work today. We are so encouraged by the transformative changes occurring in our community and by the warm and generous reception to this event. It is my pleasure to welcome you to the first annual Brighter Days Conference. If you don't know me, I'm Lynn Bullock with the Jonathan Foundation, and we're just delighted. We're delighted to be here, and we're delighted for all that is happening in this place. I want to take a moment and recognize some key collaborators here down front. First, from Department of Mental Health and PD Mental Health specifically, Deborah Blaylock. Pat Bresnan, our PD Mental Health Director. Joe Biddle, the Chief of Community Health at Care South and PD Mental Health Center's Board Chair. And then from our other co-collaborator, DHEC, we have Dr. Ed Simmer. I don't see him now, but he may be coming in, our agency director. Nick Davidson from Central Office in Columbia. Nick is over our regional operations and community engagement. And Jim Butler, our PD Regional Health Director. Ashley Tyler, our Deputy Regional Health Director here at the PD. And my mentor and former Nursing Director for PD District, Joanne Price. It means the world to have you here today. So, let me take a moment and acknowledge where this all got started with our Linda Wright grantors. Mr. Bradley Calcott with the Bruce Lee Foundation. They led out the gates, and they were our starting point. Then we have Kirsten Nemeth with the Nemeth Abbott Foundation. Mr. Wayne George with the Marion Health Foundation. And our presenting sponsor, MUSC. Representing MUSC, we have Jacob Hinsley, the CEO. Jason Cox, COO. Rob DuPont, Behavioral Health Administrative Officer out of the U.S. in Charleston, who you will hear a lot from today. Rob has been a right-hand person in helping to make the conference happen. Our collaborating gold sponsor, McLeod Health. Donna Hiskett, CEO, and Tim Smoke, AVP for Behavioral Health. And I want to take a minute to recognize the Jonathan Foundation Chairman of the Board, Mr. Lorcan Lucy from Mount Pleasant. Lorcan was not able to be with us today as he's undergoing some health issues. Lorcan is Jonathan's lung recipient. He has served with the foundation since the early days as an ambassador, corporate partner, and most recently as our chairman. He runs annually in our Run for Brighter Days, and I can't tell you what it feels like to see him motor across that finish line. We send our love and prayers to Lorcan. Our conference theme for today is Connect, Collaborate, Transform. Our mantra for this conference that I found myself saying over and over again is we don't expect to solve this highly complex social problem in a day conference. But what we do expect to do is make the connections and open up a community dialogue. We stand at the gate of a transformative time for mental health in our community with the building of the new Gene and Hugh Lehman Behavioral Health Hospital, and with a $750,000 a year grant, good for 5 years, for PD Mental Health to establish a transition care center. Both of those are going to make significant differences in our community with access to mental health services. Let us step out on this journey of transformation together and all do our part. The work of the Jonathan Foundation is born of our stories. Much of what you're seeing today is a vision that manifests through the project of 3 mothers who have lost our sons to suicide. Helen George, VP for our education sector, mother of Robert. Helen, please stand. Gracelyn Ellendorf, VP for our education sector, mother of Robert. We shared our children's stories and reviewed the American Foundation for Suicide Prevention's Project 2025 research and found correlated things. AFSP's Project 2025 team proposes that our nation can reduce the rate of suicide by 20% by 2025 if we focus on some key opportunity areas within our community. We developed 3 community campaigns. You've probably seen or heard about them. What you see on the backdrop is the billboard banner from those campaigns that have rolled out over the past 18 months. These campaigns serve as the framework for today's conference. The Brighter Days Conference was born out of a desire not only to extend the ask, but to provide our target audiences with the training to address these asks. We are so encouraged by the movement and developments within our community, particularly our health systems. Many have already implemented safer practices. It is our hope that all will join with us and stand with us to integrate these evidence-based practices into care and services to help make our community suicide safe. One extremely significant development is the new Jean and Hugh K. Leatherman Behavioral Care Pavilion. It is my great pleasure to introduce an esteemed businesswoman, Jean Leatherman. Many of you know her, but she gets an introduction nonetheless. Jean is the president and owner of ERA Leatherman Realty. You may not know, Jean grew up in Jefferson. She was valedictorian of her high school class and began her journey in Florence, or to Florence, when she met her husband, Hugh Leatherman. They met in Charlotte. They married and were married for 43 years. She supported Senator Hugh's distinguished political career, playing an integral role in his campaigns, contributing to a remarkable 41 years of service in the South Carolina Senate. Clearly, she and Senator Hugh have made an indelible impact on the people. Jean's commitment to her community is unwavering. She has volunteered extensively in schools, churches, and various civic organizations, completed Leadership Florence and Leadership South Carolina programs. She holds numerous board positions, including roles with the Florence Chamber of Commerce, the School Foundation, the MUSC Florence, and Florence Rotary Club, where she serves as program chair. Her outstanding contributions have been recognized with accolades such as Business Person of the Year by the Greater Florence Chamber of Commerce and multiple awards from ERA Franchise System and Florence Rotary Club. On a personal note, she enjoys spending time with her daughters and 5 granddaughters and their extended family. Please join me in welcoming Jean Leatherman.
Thank you, Lynn, and good morning to all of you. I will begin by saying that it is wonderful to look out over this audience and see so many distinguished professionals here. And I can assure you that I'm one of the least qualified people in the room to be speaking to you, but I am delighted to get a chance to see this participation. And so I would say to all of you as distinguished guests, good morning, and it is a pleasure to be with you here today. Let me start out by saying it is so humbling to think that this new facility will carry our names. As a matter of fact, I was trying to prepare for today, and I read the press release, and all I could do was just sit there and sob and think, this is incredible, you know, for someone who grew up in a small rural town and to have been given such wonderful opportunities to serve our community. Of course, Lynn just told you that I had the privilege of being married to Hugh Leatherman for 43 years, and 41 of those years he served in the South Carolina Senate. 20 of those he actually got to serve as chairman of Senate Finance. And the man loved that position because he could think of all kinds of ways to spend money. His visionary leadership was especially evident in support of funding for health programs. Hugh and President Fred Carter from Francis Marion spent decades working tirelessly to bring health sciences and nursing programs and advanced degrees to our area. These programs were intentionally selected to place health providers in our rural areas throughout the PD. Hugh and I both grew up in rural areas, and we know how difficult it is sometimes to find the resources that you need out of the country. He really knew that without good education and access to health care, that we would never be able to grow our wonderful South Carolina. Healthcare professionals, such as, one example, nurse practitioners, serve as frontline providers and are often the first to identify and diagnose mental health disorders. They are the key to getting people the resources that they need. Without good frontline providers, mental health issues sometimes can go unrecognized and undiagnosed. Francis Marion now is preparing psychiatric mental health nurse practitioners, now that's a mouthful, and doctors of psychology to provide professionals needed in this crucial field. So that's one wonderful component that has come out of this new facility in our community. One component of the huge support over the years for healthcare included, has included, of course, support for mental health issues, behavioral health issues. Many years ago, Hugh supported a project here in Florence called Anchor Lane. One of my favorite friends, Shirley Imbo, is here, and she personally pushed that project. I think there are 16 apartments that offer independent living for those who are struggling in life, and it was built around having a support system and allows them to function within society. Now, surely, you and I would have never known those years ago that this new behavioral facility will sit right next door to Anchor Lane. What a wonderful turn of events. For many years, we've all heard the challenges faced by our hospitals, emergency workers, many of you sitting in this room, law enforcement professionals, and educators as they try to help individuals with mental health challenges. Insufficient behavioral health resources is a problem in the PD, but also a problem in our state and our country. Many of these patients do not have insurance coverage, nor do they have an adequate support system. Hugh always said they just had no help and they had no power. So we really need advocates that believe in taking care of all of our citizens. Hugh's last legislative request, and Fred reminded me of that, was for support of the behavioral health facilities. He had a chance to be at home and the last 3.5 weeks of his life. And he had paraded people from Columbia through our home, visiting and talking to them about all the things that needed to be done. There was still so much that yet needs to be done in our state. That included his chief of staff, Clinton Hawkins, budget director, Mike Shealy, President Thomas Alexander, president of the Senate, the current chairman of Senate Finance, Senator Harvey Peeler, Speaker of the House, Merle Smith, and they all heard over and over and over again, I want $400 million to start these behavioral health facilities. I don't think he quite got 400, but he did really good. As a first of its kind hub, this collaborative pilot is poised to offer a new model for communities throughout the state to address the growing need for behavioral health services. This behavioral facility is an example of Hugh's dedication and commitment to helping others. But let me end by saying, our children and our family, thank you for allowing us to serve the people of our state for 41 years. That service has given us purpose. And now through your work in this important facility, lives will be changed forever. Thank you for being here today. I have one more simple assignment, and that is to introduce our next speaker to you. He's going to tell you all about the facility. And of course, you know it's under construction. We've got all those steel beams and everything going up on Dargan Street. But next, you will join me in welcoming Rob DuPont. Rob serves as I don't have to read this now because this is all technical, and I'm not a medical person. Rob serves as Assistant Administrative Officer of Behavioral Health for MUSC in Charleston. He holds a BS in Therapeutic Recreation and a Master's in Healthcare Management. Rob has had more than 20 years of hospital-based behavioral health experience, having started on inpatient child and adolescent services, and also having worked with adult populations in acute residential and forensic settings. He has maintained a focus on program development and improving access to behavioral health services. This is going to be a wonderful opportunity for him. Join me in welcoming Rob DuPont.
See if I get this on a minute. I want to make sure that you can hear me too if you can say anything here. So, well, good morning, everyone. Thank you so much for the introduction. Our work really, a motivator for us has been to create a vision and create our goals around the mission for both Gene and New Leatherman. And so I hope that we've done that and want to be able to share that with all of you today. We're going to talk about where we are now and what that vision is and how we incorporate collaboration all this work that we've done to get here. First, just a moment, it is May. May is Mental Health Awareness Month. And so part of that goal is how do we reduce and end stigma, and that's what we're doing here today. And a huge part of that is awareness, education, discussion on some of these hard topics that need to be discussed. And so thank you all for being here and taking part in that, increasing that awareness. This work and everything we're doing, pulling the community together around these topics and these needs, all is work around reducing and ending stigma and improving the services that they need. So thank you for that. So, as mentioned, I've worked in behavioral health and hospital-based services for over 20 years. And had the opportunity to work in a few different states along the East Coast and at several different hospitals. And there's certain things that come up. And in different areas, you're going to see how do you get the right access to care, and how do we have access along the right services along a continuum of care. So however we design programs with the different things that need to be, those are the two things that always are going to be a part of that. How do we get people to the right services, and how do we have the right services available there? Sometimes you see the display of what's that care continuum, it's linear. And so you've got low acuity kinds of services here, high acuity services like inpatient here. Trying to come up with the right design for what that is, because I do think it is more circular than linear. There's not really a starting point or ending point. You can go from one place to another. All those services are there really to wrap around the patient. How do we figure that part out? So as we try to envision what we need from this facility and for the area, we need to be thinking about that continuum of care and what does that look like now, and what does it kind of look like in the future. Mapping out resources that exist in the PD region, there's a lot of services that exist, and there's great services that are there, and they're all really important services that we have. But if we think about the continuum and the range of services that can exist, a lot of us focus in on these three areas that we're not filling in everywhere. So as we started to think about what do we need to do to make a difference, make a facility that's going to meet the needs of the community, we want to get closer to that full continuum and filling in some of those services. When we think about that collaboration, it's not about duplicating services and say, hey, these great services that are here, we're going to do more of the same thing and call that good. And that's where a lot of that work has been to determine and to really know what's going on in the community and say, okay, this is here. How do we do something different? How do we work with all of those groups to make sure that we're building off of each other and to be able to fill those gaps as best as possible? Fill in the care continuum gaps, create better access, which puts us in a better place. As mentioned too, no state is perfect at this. There's challenges across the country. There's annual rankings and kind of ratings on how each state is doing in these areas, and it looks at access to insurance coverage, people who need help and are able to access to help. And South Carolina as a whole doesn't do a great job. We end up in the bottom 10, so 42nd, 43rd, around at 50 for those components. So we've got opportunities. And so all this work that we're doing and you being here today is how do we move that in the right direction and increase all the services. Also just want to take a moment as we kind of talk about where we are today. This timeline and this work has been going on for quite a while. Started really as a grassroots need in this community between the hospitals, between mental health and home health, to say, we know that there's a need, we've got to do something about it. How do we start getting organized there? So that goes back 4 years for that work. And behind the scenes in Columbia, Hugh Weatherman and others doing all this work too to say, PD needs this. How do we start getting focused there? So things happening in parallel tracks to get us to where we are today. In April of 22, with a lot more direction to Robbie Kerr in the Department of Health and Human Services, he created a master plan advisory committee to really target in statewide behavioral health needs and how do we do that. As a part of that, he gave us direction to get more organized on the work that we're doing, create that proposal and get that back to help support in that funding. That's what really kicked this off. So a huge thank you to him and to his team and everyone in the state who has made funds available to create this resource for us to build a program and a facility that is intended to meet all these needs. So here we'll have a better picture later that gives you a rendering of what we expect this facility to look at. You can see the logo there is UC Health, Gene and Weatherman Behavioral Care Pavilion. So just beautiful building that is in construction now and will start to take shape more and more as we go in the following months here. So as we think about what does that vision need to be, this is already kind of trying to encapsulate all the things that need to be for that. People have said, we have a regional hub. Well, that's a big term. Like, how do you define a regional hub and all the things that needs to be, and how do you accomplish that? So what we really see this to be is the vision for the Loudoun Behavioral Care Pavilion provides a comprehensive array of high-acuity specialized behavioral health services, conveniently located in centralized state-of-the-art facility. The regional hub enhances accessibility through collaborative partnerships, seamlessly increasing awareness and connecting patients to resources throughout the region. By offering a robust training and education environment, the pavilion provides workforce development opportunities and lays the foundation for future regional hubs of its kind. That's a whole lot there. We'll look at it kind of just 4 main parts a little bit more specifically. Regional hub, and so what does that hub need to be? It's not going to replace those services, but how do we use this as a grounding for the services that exist? So as I mentioned, it's to add in services that aren't there, and we'll talk about those specialized services. How do we connect in with those other services that are there? Getting support from the facility, but also then as people leave the hospital and they need to be back in the community. That's where people live, that's where they need to thrive. So how do we connect back into those organizations as well? And you see the arrows on there by direction. So it says people come in and go back. How do we work together to, in that collaboration, that really makes all of our services better. It's that, the sum of our parts are better, great, to say how all that goes. High tides raise all boats. We need to be able to have those services there that sort of elevate all the services that we can provide. So it's really the vision around creating that hub and having that centralized there. So that accessibility through collaboration, build over time, we're doing great. These are some of our initial partners. This is continuing to grow and lots more that will be added on here through time. When we look at a couple of different sectors, I mentioned the Health Connections, Medicaid, Department of Health and Human Services, and the support there. This wouldn't be possible without their support for the funding, which has been going through our state government and the resources that have been there. But also huge support from the City of Florence there. We really thank them as well for the support for creating this resource in the downtown and we feel continuing to elevate all the services and things that exist in the downtown community. A number of clinical community teams that are on there, and again, this will continue to grow as things have started. We're 16 months from having the hospital open. All of our focus now is how do we connect with all those areas, how do we make the right programs exist within the facility to connect into those other areas as well. Education, here are a few people and organizations that we're starting to work with, talk about that education and training. That's going to be a huge part of what we need to do and what we want to do. And so all of these organizations have been part of that discussion, and that will continue to grow as well. We talk about collaboration, how do we get organized around that? So we've created a governance model that pulls in some of those key stakeholders and also community advisors. So these meetings will get started here in the near future to be able to have continued updates for our community stakeholders and also to be able to get that feedback on where we are, what it needs to be, and how do we continue to grow and develop. The ideal of day one, we have every resource in place, every program that's going to be. I think things are going to continue to grow over time, even after we're able to open the doors for the hospital. And a lot of that we will do within there, but also around these community collaborations and how they continue to grow, what can happen there. A big part of this will come through that governance council, making sure that everyone is fully up to date on what's happening, and also getting that feedback on what those continued needs will be. So training and education opportunities. One of the big components as we've developed the clinical programming, what do individuals and patients coming into the hospital need? How do we continue to build a workforce? How do we have a resource that has an array of services and make sure that those training and education opportunities are there as well? So this gives you some representation of medical schools, nursing schools, and social work and clinical counseling programs that exist. And some of those are the early discussions of how do we build off of those training programs. A lot of schools, and we hear mentioned, is that we increase our program, we can educate students, but we don't have any place for them to train. We need clinical sites for them to be able to do that. At the same time, we're trying to build programs. We said, well, we could build more programs if we had the workforce to be able to fill those roles. So it's a little self-serving in some of those ways. When we need people to be able to provide those expertise and those services, we need to be able to train them as well. So how do we work together to make sure that those opportunities exist? So part of that development for this facility is graduate medical education and residency programs that we can build through our own organization, but knowing that other organizations and teams that are educating these young professionals will also have that opportunity to come in and have training within the facility as well. So that's going to be a huge component of making sure we're connecting in. That's a collaboration that isn't even around clinical care specifically. How are we building the workforce? How are we building training opportunities that everyone can be fully where they want to be? We know that big goal for the area too is we want to educate people here, we want to keep people here. Having more training opportunities within the area, we believe can do that as well. Lose my back. All right, and then if we talk some about what those services need to be. When we thought about that continuum of care, what we need to sort of make sure we do, I mentioned access in the beginning. Access to services is a huge part of it as well. Also, in-house services and crisis stabilization, and so whatever nomenclature we use, we'll talk about what that service would be. Outpatient and inpatient services. Part of the struggle that we see in Florence and PD and across the state is that individuals are in crisis, they end up in the emergency room, and then the only answer is, well, we need to get them to an inpatient bed. Well, there's no inpatient beds available in the state, so what do people end up doing? They wait, and it's the worst place, it makes the crisis worse, not better, sitting in a medical ED, trying to get to the right service there. So part of the solution is, do we need more EDs for people? Not necessarily. Do we need more inpatient beds? Partially, but that's not the whole part. It comes back to the continuum. If we have access in the right places on the continuum, part of that goal is keep people out of the ED. Worked with a tech for many years, and her motto is it's easier to put out a spark than a fire, right? So the early signs, you have a small need, access to care in a small need, wonderful. If you don't, is it going to go away? The crisis isn't going to go away, it's going to get bigger. So then that's where people end up in the ED. So we want to balance that as much as possible. So we do have inpatient services, we'll talk about that, but that's not the only answer. Access center, and so that is really to get that access. So that will be centered in that empath in a crisis area. And the goal of that is just that. People walk in or schedule appointments, how do we get immediate access into assessment, which then is able to connect people into that right service that may exist. We know that sometimes people will need inpatient care, but a lot of times they won't. So how do you do that? That service may be with us within the facility. Oftentimes it's going to be outside the facility, so how do we do that? Some of the discussions with our team, the community teams in Florence, is how do we make that a warm handoff? What are ways that we build care navigation that maybe have that included in the facility? So if people are coming in and saying, I need something, what is it, I'm not sure, help determine what that need is, and then connect them right into that service. That's that bridge for access that we feel is important. And one of our key areas there, how do you get the right person to the right services? So that's that goal of the access. Built around that is that empath model. That stands for emergency, psychiatric assessment, treatment, and healing. And it's a model that also the state has put significant funding towards, about $45 million. There's 13 sites that are becoming in operation. There's a couple at the start of this spring and others that are still in development to open here. And McLeod will have one, so there'll be another resource here in the area. How do we get people don't necessarily, it's emergent, they're in a crisis, they need that evaluation, maybe need 24 hours, maybe need 48 hours of support to be able to address the crisis, come up with the right plan that gets them back into the community where we want people to be, but isn't an inpatient resource. So it's connected in with that access center, so we have that ability to provide that level of care for individuals who need that resource, not need a 5-day to 7-day inpatient stay. How do we avoid that and provide that right level of care there? So we think that would be a huge component in both those things. Access, but it's access to the right level of care, knowing that people not everybody needs inpatient, so we don't want to put them there if they don't need it. Outpatient services, one of those early slides showed there's an array of some inpatient and outpatient services in Florence and across the PD. One of the things that there's very little of is PHP and IOP programs. So those are partial hospitalization and intensive outpatient. So that's our key focus of what we want to be able to build into this program. These are really great too. If someone does need inpatient care and they're ready to go home but still need a good amount of support, transitioning into a program like this is very, very helpful because it provides daily, almost daily continued support as we're getting reintegrated into the community. Also a great resource if someone is in outpatient care and not doing well, to step up into this level of care. It's more intensive for that span of time that they need, but they're still sleeping in their own bed at night, you're eating food at home, you're living with their family, so not having a hospital stay. That's where that partial hospitalization is as close to the hospital as you can be, but you're still going home at night and being able to do that. So great resources for providing a higher level of care that also keeps people at home at night and provide that support and staying out of the hospital, staying out of the emergency room. The inpatient services that will exist, we know there's a couple of areas of biggest need, as we discussed, where we need more adult beds for that age population. We also know that within there, not every person in the inpatient has the same need. And so some individuals have a very acute need, and some of the care that we need to provide is slightly different. So one of our units would be a smaller unit, 11 beds only, so less stimulating that way, and more specialized care for those individuals who are really in an acute psychiatric state and need a less stimulating specialized program there. So an adult program, we have that specialized acute care for adults as well, and then adolescent unit. There'll be a 12-bed unit there. A lot of thought and design going into that. We've got adults and children and adolescents in the same building, of how things have been designed that they can navigate the building and get access to physical activity for arts, crafts, other tabletop needs and activities, outdoor space, the indoor space in the unit there, all is contained where there's no interaction with the adults there. So I think we've come up with a design and model that allows us to offer services across the age range, but also separates everyone out so we're able to make sure that we're keeping the adults where the adults need to be, keeping the peds and the adolescents where they need to be. So knowing that that's an important part of it as well. So if we think about where we are today, I'm sure many of you are familiar with the old Cedar campus, Cedar Street in Dargate. So this is what the building looked like July of 23, just before it started to come down. Hopefully you had an opportunity to see some of that demolition. It was pretty cool to see. Here's a picture in December where the larger tower was coming down. And then, so we were hopeful if it was going to be dynamite, just take it all out at once, or a big wrecking ball. A little less dramatic than that. They kind of came, took a piece at a time and pull it down. End result, though, is that the whole building was gone. I'd say part of the reason, too, for doing it piece by piece, if anyone's able to see, they separated out all the piles. So as far as the green efforts for that was to make sure that all the right demo went to the right places, the recycled and reused in the right way, so that added effort around that demo. So this is changing all the time, but this is as recent as maybe a week or so ago of what that looks like. You're able to see the beam out in the lobby, so if you haven't had a chance to sign it, please do. And that will be resurrected, erected, what's the right word? We will go on to the facility next Wednesday as the final kind of keystone, the final beam for the building. And then we'll get that roof finished in, and then here, starting in June, we start closing in the building and really move us into that further development. So beautiful to see. It's becoming a building. It's actually there, and I think it'll look great. Here's that rendering again of what that'll look like here in the future. Also, below there is the link. Not able to click it from there, obviously, but if you did a search for it, you can find there's a live camera on the site. So if you want to see what it looks like today or next week or any time for that development, you can continue to watch as this building goes up. It'll probably be less dramatic once the walls are closed in, because all that will be inside at that time. But it gives you a good idea of where that progress is over time. And these are rendering, we'll be very close to this, of what it will look like in the future. This is that view from Dargate Street, so we'll face the main road out there and really show proudly this is just a beautiful facility, and within those walls, the amount of services that we can provide for everybody in this community and across the region. So really, it's been an amazing experience to get here. As I showed you, it's been years in the making just to get to this point. We've got another year's worth of really heavy work to get to a point where we can open the doors. The work doesn't stop there, of course. There will be more to do and continue there. So we hope that we can fulfill that vision of what the community sees as a need for looking at the data, that we can talk with the community resources and people that know. We really do feel like this is that key component that can really make an impact for this region on services that we know are so desperately needed. So how are we doing on time? I think we'll probably have years but I don't know. So thank you all again for being here today. And we'll be talking more about this, and Tim and I are going to have a breakout session specifically on the program and some of the collaborations. So we'll talk about that more if you want to hear that later today. But thank you all for your time for that. I'm going to hand it over back to the
Awesome. Thank you so much, Rob. And I have the pleasure of making a brief announcement here. So the Jonathan Foundation, with the significant gift of a very generous donor, the Bill Daly family, are pleased to announce a new program that will be designed for the Lebanon Behavioral Health Facility to offer overnight bags for patients who come in and are admitted. We know that many of them will come in crisis. They won't have time to pack a bag. And we'll work with you guys to let you help design what we need to put in those bags. And I know we have a number of community organizations in the room that also serve the mental health cause. If you're interested in being a part of that, it may be that resources can be part of what we put in that bag, as well as the essentials that they need for their hospital stay. And so that is Mr. Bill Daly and his family, and the program will be called You Are Not Alone.
So I'll just say thank you so much, and exactly right, as people are coming in, providing services is not always easy, right? So the mindset and the right thing to think about is, what would I want for my mother? What would I want for my sibling or someone in my family? And the other part of that is we catch people at their worst days. How do we remain at our best and provide them what they need? And a physical, tangible resource that is needed are things like that. A piece of home or something that they have there, or to take with them as people are in crisis and coming out of that. So that is wonderful. I thank you very much for that. Very good.
We really appreciate Mr. Bill Daly. I'm so sorry he couldn't be here. He wanted to be, but if any of you know him, please give him our regards and gratitude. Okay, so do we have anything else before break, Julie?
All right, so we are going to take a break and go into our sessions. You have a little bit of extra time, so make sure you go out and meet the people who've set up the vendor tables and find out what resources are available. Make sure you get your CEUs registered if you have any questions. AHEC's right out front, they can help you walk through that. So if you are staying for the health care, you get to stay in this room. You don't have to go anywhere. Although you should go out and meet the people in the hallway. If you are in first responder, we're going to meet over in room 105, which is actually right out here on this hallway. And if you're in education, we're going to go all the way back around by where you registered. So you go up, you're going to turn, and go all the way back towards where you came in. That front room, 102 and 103, I believe. But you'll see that room open. So we've got about 20, 30 minutes, but head towards those rooms. The earlier you get started, the more questions you can have answered. So we'll see you in your breakouts. Oh, and don't forget to stop by the beam and sign in and get your picture. You've got plenty of time.